today I'm joined by Noella Bigirimana from Rwanda Biomedical Center, and she's here to talk to us about how effective masks are and in the prevention of coronavirus. Welcome, Noella.
Thank you, Gloria.
Yeah. So can you please tell us about how effective, like yesterday when they announced the first corona case, various people were seen on the streets wearing face masks, saying that they're preventing the spread of the coronavirus, but are they really effective?
Mm-hmm. Well, thank you for having me. It's an important platform. So I'm part of the joint task force that's been put together, and this brings together multiple institutions across the country. And as you said, preventing the infection and the transmission remains a major priority. And this is the messaging that we've been sharing across the country, whether it is communicating ways to avoid this coronavirus. So some of it is this communique about avoiding the mass gathering, and the Ministry of Health put out a communique yesterday. Other ways are washing hands, and this is very important because one way of transmission is it's not airborne. The virus is actually transmitted through droplets. And that's one of the reasons why hand washing, whether it's with soap or sanitizer, remains a very, very important part. When it comes to the mask, to answer your question, not everyone is recommended to wear a mask. The priority is given to people in the front line that are interacting with potential cases or confirmed cases. Yeah. We're talking about healthcare workers, and we're talking about maybe people that are infected and have been asked to wear a mask so as to avoid the transmission.
Okay, but based on the latest information that we've just gotten now, that there's 4 more cases of the coronavirus, and one of them didn't have any recent travels abroad. And we know that the virus is spread through membranes, mucous membranes. But because of the social life that we have, day-to-day lives, doesn't this pose a risk? Don't you think this is why people are actually going out to buy the masks to wear, because they can't avoid being in the presence of other people, and whenever someone coughs or sneezes, you can't be sure that maybe that's not the coronavirus?
Mm-hmm. So that's why it's been a focus of our communication and community engagement, being able to understand that what's important, what the biggest barrier is for the person that has the virus and infection not to transmit it. That's why they wear a mask. For somebody else, and that's why social distancing has been put in place as well, is what's important to understand here is that these measures are in place because of that. So we are trying to avoid being in close proximity. And one of the things in the mass messaging, for example, and the communication that we've been sharing is that avoiding, when you're sneezing or coughing, being able to use your sleeve to avoid coughing or sneezing on someone else. But what we've seen in other countries is a fear. And this fear that has actually been dangerous. One example being that in one of the countries, everyone went to get masks. Yeah. And when it was time for the people that really needed the mask, there was a shortage. And that made the epidemic worse. And that's what we're trying to avoid here in Rwanda.
Okay, so at what point is someone required to wear the mask?
So the person will be advised, whether you are confirmed cases, we've heard that they're still very contained, right? They're in isolation. I wanted to come back on that. They're in isolation and they're in stable condition. And anyone else that's been told and advised to wear the mask, but not the general population. And that's something that the WHO actually has continued to come back on.
So you're saying it's not necessary to get a mask without any symptoms?
Exactly.
Okay. So now let's talk about the coronavirus infodemic. There are stories about how eating lots of garlic, gargling with mouthwash can cure the disease. Yeah. How harmful can false information about prevention measures and the so-fake cold cures be to public health?
Mm-hmm. It's very, and here we have to be careful because a lot of these news are coming through social media. And so through social media, it's such a powerful tool for information, but also misinformation. Like I said, if we come back to the ways that this virus is transmitted is through droplets and close proximity with a person. It is true that in some part the virus is susceptible to warm temperatures. So you'll see that it does not survive on surfaces for too much, right? Just for several hours. And so when you have that in mind, it's very, very important to look for information in the right sources. And what we're doing with our communication strategy is to make sure that we're putting out the right kind of information to the community and avoiding this misinformation. You'll start to see most of it circulating online. I think it's very important for our viewers tonight to understand that you have to look for the right sources so as to avoid panic and cause further damage.
What are the right sources? Where should someone go to look for the correct information about the virus?
Thank you very much. So we are making sure that we are putting out very relevant information, whether it's through the RBC website, which is updated daily to have the most, and I believe the president tweeted about things that are in terms of science and best practices to make sure that you're actually getting the information at the source. We also work with information from the WHO, from the CDC. So these are sources that are known, that are putting out the right information, not based on fear, on rumors, but based on science and evidence of what we've seen.
Okay, thank you so much, Noella.
Thank you very much, Gloria.
Yeah, that was Noella Bigirimana from the Rwanda Biomedical Center.